I'm Dr. Dan Fortenbacher, and on behalf of the Vision Help Group, it is indeed my pleasure to be interviewing today Wendy Rosen, the author of the book, The Hidden Link Between Vision and Learning, Why Millions of Learning Disabled Children Are Often Misdiagnosed.
So I am a teacher, and over the past number of years, I've actually been working as an education consultant. And one of the areas that I specialize in is vision-related learning problems. We often don't understand how the world looks to a child. We can hear when a child has a speech problem. We can pick up on a child that may have an auditory problem. But a child with a vision problem, we don't really know what's going on because we are not seeing the world through their eyes. I wanted this book to be for everyone, and it really is. You don't have to be a teacher or a doctor or a therapist to understand the content of this book.
Wendy, writing a book is a huge commitment of time and energy. Can you tell us a little bit about the evolution of the writing of this book?
Well, the idea for the book grew out of the many professional development workshops that I led for teachers about this subject. And at the end of my presentation, inevitably I would be asked, how can I help my students who have this problem? What can we do? So the book provides in-depth explanations of all the different visual skills that we use every day. So a teacher can come away with a real understanding of, well, if a child is exhibiting this symptom, it might be caused by this visual skill deficit. Something that few teachers are aware of, and child study team personnel and school administrators, is that a vision-related learning problem can actually be at the core of a learning disability. When a child is struggling with convergence insufficiency, for example, it's very hard to maintain your focus. And when there's a reason for that, they will instinctively try to relieve the stress that they're under. And how do they do that? They will simply look away from their work because they need a break. So they'll look out the window or they'll look across the classroom. And of course, these aren't behaviors that a teacher likes to see because it looks like a child is goofing off or like they're off task or they're just not getting their work done, when really that child is just trying to cope. The child who asks to leave the room often for water breaks or bathroom breaks or to go to the nurse, or the child who distracts themselves or is very wiggly in their seat or causes distractions. It's because in some cases these kids have this going on and nobody knows it, and they're just trying to cope. So doctors need to be equipped with this knowledge. So for example, when a parent comes in and says they're having their well check and they ask how they're doing in school, and the parent says, well, my child is struggling and they have this, and this going on, and right away, sometimes a doctor might think, well, we should consider that this might be ADHD because it's very common. There are many overlapping symptoms between, for example, ADHD and a vision-related learning problem, and unless you know that 15 of the 18 symptoms of ADHD are also present with the vision problem, and that 13 of the 17 symptoms of dyslexia are also present with a vision problem, we can see how easy it is to misdiagnose a child. So having this knowledge could potentially impact the entire course of a child's life. It's important to understand that there's a lot of misinformation out there about the field of developmental optometry, about office-based vision therapy, because I believe that there's an inherent lack of understanding among professionals, even in different branches of the eye care community. And it's very important to have a dialogue, an interdisciplinary dialogue, so that we make sure that everyone is educated in a way that is accurate. So it's very important to understand the difference between vision and eyesight. Very often when we talk about vision, we are thinking of some 20/20 reading. And that 20/20 reading is only a very small percentage of a person's visual story. It's basically how well a person can see at a distance of 20 feet. And there's so much more to vision than that. With normal binocular vision, our eyes come together, focus on one place, and send one image to the brain. When the eyes are not able to do that, when they're not able to coordinate and team, we're actually looking at two different places and sending two images to the brain. There are two wonderful organizations that can provide resources for parents who want to pursue an evaluation with a developmental optometrist. The first is COVD, which is the College of Optometrists in Vision Development, and this organization provides continuing education and board certification and fellowship opportunities for optometrists who want to pursue a career in developmental optometry, and their website is covd.org. The other is OEPF, which is the Optometric Extension Program Foundation, which provides continuing education for optometrists as well. And OEPF.org is their website, and they can also find a developmental optometrist there. So either of these two websites would be a wonderful resource for parents to check out.